Wonderful students, I, Dr. Jyoti Vaipavi, welcome you to today's lecture video. Today we are going to learn very important concepts about unipolar limb leads, augmented unipolar limb leads, hexaxial system and chest leads. So these are the specific learning objectives. In that we are learning today the SLO number 3. Please go through them properly. To have a good concept about unipolar limb leads, you should first know the difference between unipolar and bipolar limb leads. As we all understood in last class, bipolar ECG leads have two poles, right? One is positive pole, the other one is negative. In unipolar leads, unipolar lead also has positive electrode, but the negative electrode has through multiple resistances and connections has been modified into indifferent electrode. Okay, it is called by various names like virtual electrode, near zero electrode and null electrode. So in previous lecture we had understood how Entowon amazingly invented bipolar limb leads and recorded first ECG, right? During the first 3 decades of that was in 1900, and during the first 3 decades of the 20th century, the 3 lead ECG usage expanded like anything, especially after improvement were made to make it more portable. Okay, doctors started using ECG for everything. So electrocardiograms were initially used to study arrhythmias. Okay, in 1909, Sir Thomas Lewis of University College Hospital, he discovered delirium cordis. Okay, this is a clinical diagnosis of irregular heartbeat, and this was as a result of atrial fibrillation. So he discovered this only by using the ECG. So after recognition of this, then there was a recognition of myocardial infarction as a clinical entity in 1910. So many attempts were made to recognize to record the ECG patterns suggestive of ischemic heart disease. Okay, and then what happened in 1930? Um, ECG was extensively used to differentiate between cardiac chest pain and non-cardiac chest pain. In fact, some patterns was considered so characteristic that the ECG alone could be used to diagnose myocardial infarction. So, while 3-lead ECG was a satisfactory method to assess arrhythmias, it was also helpful in so many things. They recorded ECG of arrhythmias, and also to diagnose, differentiate between cardiac and non-cardiac chest pain, and also some kinds of myocardial infarction and all that. But soon they recognized that there were silent areas in the heart where a myocardial infarction might not be detected. So these leads which they put on which Entowon made, so they were able to record only these degrees, 0 degree, 60 degree. They could see the heart only with these angles. But what about those angles which we could not see? So there were so many silent areas of the heart which could not be seen by this bipolar limb leads. So there was a problem here. So much of MI cases could not be diagnosed because ECG wasn't able to record these silent areas. So this was the major problem of Entowon's triangle. So then what happened? So then Mr. Frank N. Wilson, okay, in 1934, he was from University of Michigan, developed the concept of central terminal. So here we have to definitely mention about his great contribution, what this Dr. Wilson did in the field of electrocardiography. All of the work of Wilson was on the work primarily he worked primarily to explain why certain changes appear in ECG. Some of his earlier work were concerned with the arrhythmias and other allied subjects. Okay, much of his research was devoted to study the ventricular complex and his contributions in connection with bundle branch blocks, myocardial infarction, ventricular hypertrophy, and abnormalities of the T waves. So, mm basis of much of our current knowledge of these condition is because of Wilson's research he has done on that. All the things what we know about the all these abnormality is basically because of his research. Okay, and one more thing important about this Mr. Wilson was that his long familiarity with the bioelectric phenomenon, his keen and inquiring mind, and his mathematical abilities were too good. It was amazing. So this enabled him to devise something called a central terminal. It was an arrangement and one of the most ingenious and basic concepts in the field of ECG was this electrical making central terminal and creating ventricular gradient. So he successfully developed unipolar limb leads and Wilson's unipolar chest leads. Even today, what we are using the chest leads are of Wilson's, the one which was made by the concept developed by Wilson. So, what did he do? How did he rectify these things? Okay, so as I discussed, the ECG interverse triangles, bipolar leads were able to record the myocardial infarction which was happening in the silent areas, were called as silent areas in the heart, where MI could not be detected using ECG via this bipolar limb leads. So, Dr. Wilson wanted to see electrical activity of these silent areas, the angles which in between these leads which could not be seen, which was missed. If, for example, if a person is having a MI in this one of the silent areas with the ECG cannot record, that would be not recorded on the ECG and MI could be missed. So what did these people do? So Dr. Wilson wanted to make a lead where he could see the areas in between the leads which bipolar limb leads could not see. Okay, were unable to record. So he wanted to make a lead which can fill in the gaps of this bipolar limb leads. And Wilson did not want to complicate things and put more and more electrodes and all that. He wanted to retain the Entowens triangle, so he has retained the Entowens triangle. Okay, so Wilson started thinking how to put a virtual electrode in the center of the heart. I want to record right in this area and how to record it. So it was in 1930s, and obviously we could not do a heart surgery and put a electrode inside the heart and see what's happening in the silent areas. So what did these people do? This Wilson and his colleagues came up with this amazing idea. So Wilson used his amazing mathematical abilities and came up with this idea. So what was this idea? So idea is, so in mathematics, if you take a equilateral triangle, so we take a equilateral triangle and you put some charges. For example, in all the apices I put negative charge. I take a equilateral triangle. One second. So you take a equilateral triangle, okay, and you put negative charges in all of the apices, okay. So what happens, the sum of all these charges, if I sum up all these charges, okay, it will come up to 0. So the sum of these charges will come up to 0, that is somewhere in the center, it will be 0. This is what if you take a equilateral triangle and put the same charges happen, so it will become 0. So what Wilson did is he took the equilateral, the triangle, he took this same interverse triangle, and he put negative electrodes on all these limbs, on the right arm and left foot, right? And he connected all of these leads. Okay, can you see? He's connected all of these leads together. So when he connected all of these limb leads together, he got a zero potential. Okay. So then Wilson and his colleagues measured the potential of all the electrodes and summed them together and connected to common terminal. See, they have connected to a common terminal and called it as a central terminal, which gives a zero potential. So what they have done this they have converted all the negative electrodes into a indifferent or near zero electric electrode. So, and he told that it is as simple as putting a virtual electrode into the center of the heart, because the zero potential comes almost nearer to the center of the triangle. This is how this is how Dr. Wilson and his colleagues made a central terminal. So they just, by putting negative charges for all the apices and connecting all of them to a common terminal, they made it into a central terminal or a virtual electrode. Okay, this is how Wilson created a virtual electrode. Okay, so now as we can see, it doesn't actually make a equilateral triangle, isn't it? So right arm is here, left arm here, and left foot here. It is actually not a equilateral triangle. Hence, little potential. So exactly, it won't be zero. There will be near zero. Little potential differences will be there. So they added, what they did for each of the arms, they added this 5000 ohm resistance to each limb. Okay, they added 5000 resistance to each limb to get near zero potential and made a common terminal. Okay, now this is how the central terminal was made. Okay, by connecting a 5 ohm resistance to each limb electrode and interconnecting the free wires, the common terminal or the central terminal is the common point. Okay, if you see in this, they made this. So the central terminal represents the average of the limb potentials. All these potentials coming from each limb is almost zero, because no current flows through a high impedance voltmeter. The circuit of the Wilson central terminal, the location of the Wilson central in the image space. Okay, this is showing the circuit of the Wilson terminal. So he just connected and put a 5 ohm resistance and made a common terminal. And this picture over here, it is showing the location of the central terminal in the space. Okay, even though you have connected it here, but in the space, the center of all these equilateral triangle comes to the center. So now, how did he record it? So he made the central terminal. He converted all these negative electrodes into indifferent electrode now. Then how did he record it? That's the question, right? So after making the central terminal, if he wanted to record this foot area, okay, so you know this is what Wilson did was he put negative in the all the triangles, right? He put negative and connected them to a resistance, and it became the central terminal. So if he wanted to record this, one second, okay, I'll take black. Okay, if he wanted to record the electrical activity from the foot, if you wanted to see right into the heart through this 90-degree, he put the positive terminal here. So it became VF, or just F dash, you can say, the Wilson terminal voltage of the foot. Okay, VF. So if he wanted to record the electrical activity, so from, and wanted to see the heart from this angle, he put the positive electrode here. Okay, And if he wanted to see the electrical activity of the heart from this angle, he put the positive electrode here. If you wanted to see from this one, he put the, wherever he wanted to see the heart, whichever angles which he has created newly, so he put the positive electrode here. In this way Wilson made, so if he put the positive here, it became VR. Okay, Wilson voltage of right arm and voltage of left arm. Okay, this is how the Wilson central terminal and Wilson limb leads were made. So now he could record those areas of the heart which bipolar limb leads could not measure. So all was good. Okay, but now there was a problem here. When Wilson recorded after doing all this, so the ECG waves which Wilson recorded was very, very, very small. It was almost unreadable. There was a big problem. So all the scientists, they said it was not the right method and they didn't wanted to read this. So we'll see how the Wilson's ECG looked like. So this is it. So this VR, VLF, VF, you can see it's very small. You cannot even count them. So it was very small, and the ECG Society, they discarded this. They said we cannot use the Wilson's limb leads to record. Whereas you can see the bipolar limb leads, lead 1, 2, 3. You can see the so big QRS complexes are there. Here you can hardly see them. It was very small. Okay. So Wilson's was very low, small, and all this. So Wilson's unipolar limb leads could not be used. That's what they said. So then what happened? Then came our Emmanuel Goldberger, who wanted to use the same unipolar leads because he extensively studied Wilson's leads, and he wanted to use the same limb leads to study the silent areas, and also he wanted to augment the Wilson's leads. So to say a few words about Emmanuel Goldberger, he was the American cardiologist, and I'm so sorry I couldn't find a good picture of this great man on the Google. If any one of you can get a good picture of Emmanuel Goldberger, I'm really happy to use that picture over here. Okay, so what did this great person do? So Emmanuel Goldberg, the unipolar extremity derivatives derives to, so whatever the limb leads we are using today, the unipolar limb leads we are using today in the 12 lead ECG, we have to all the credit should go to this great man Goldberger. So you should definitely know a little bit more about Goldberger other than his works. He graduated from the City College Downstate Medical School in Brooklyn. He then worked in private practice as well as at various hospitals including Montefiore Medical Center, Albert Einstein College of Medicine. Also, he taught at New York Medical College. Okay, in 1942, he described the unipolar, almost pseudo-unipolar extremity derivatives and called it as AVR, AVL and AVF, also called as augmented VR, augmented VL and augmented VF, which were later named after him. Okay, also he has written numerous textbooks. So today's ECG, whatever augmented leads we are seeing today, it should, all the credit goes to this great man over here. So what did this guy do? So Goldberger and his colleagues analyzed Wilson's limb leads and found the problem. So what was the problem? So Wilson and his colleagues, wherever they wanted to record with this positive electrode in the Wilson's leads, there was also a negative electrode because the triangle was made by negative in all the apexes, right? So wherever he put the positive, there was already a negative electrode. So these positive and negative partially cancelled each other and the voltage dropped. So Goldberger modified these Wilson leads. What did they do? So wherever this Wilson had put the positive electrode, Goldberger removed the negative electrode from that apex. okay, and retain the negative electrodes in the other two apices, okay. So, so what happened to the central terminal now? So now it is no more a equilateral triangle, isn't it? So what happened to the central terminal? So it gets shifted, okay, it gets shifted here to the midpoint, okay. So if you're recording here, instead of stopping at the heart, it gets shifted to the midpoint of this negative electrodes, but the axis remains the same. It is recording the same electrical activity with the same angle, but the central terminal, instead of being in the center of the heart, it comes in between these negative electrodes, okay. So let's learn one by one about the augmented unipolar leads, augmented AVR, that is augmented voltage of the right arm. So how did he make this lead? Goldberger put the positive electrode on the right arm and negative electrode with resistance on the left arm and left foot. So it became the AVR lead. So these two terminal became the indifferent electrode, and the positive electrode, it became the positive. So this is how the unipolar limb lead was made, and uh, the axis can be drawn like this, from the positive to the midpoint of these two electrodes, to these two indifferent electrodes, okay. So how did he make the AVL? Goldberger now put the positive electrode on the left arm and negative electrodes with resistance on the right arm and the right foot. On the left foot. So this became the AVL lead. So this is the indifferent electrode and this is the positive electrode, that is the unipolar limb lead, and the axis is drawn from the positive electrode to the center of the other two indifferent electrodes, okay. And AVF, okay. Goldberger put the positive electrode on the left foot, negative electrodes with resistance on the right arm and the left arm, okay. It became the AVF lead. The axis can be drawn from the positive electrode to the midpoint of these two electrodes, okay. This is how AVR, AVL and AVF were made. So now let's make the triaxial system for the augmented unipolar limb leads. So same triangle, the interones triangle, and now we are making a augmented limb leads. So we are just taking the AVR from the positive to the midpoint of the other two indifferent electrodes, AVL positive midpoint of the other two electrodes, AVF from positive here to the midpoint of the other two electrodes, okay. So AVF is see exactly vertical, and from the right side AVR is seeing the heart, AVL is seeing left side of the heart, and it is seeing just the vertical axis of the art, okay. So I'll just take the AVR out and AVL out and AVF out. So this becomes the just sliding whatever the leads or the axes are there together, we get the triaxial system of the augmented limb leads, okay. So if you can take the angles, so in the bipolar limb leads class, I had told that lead 1 will be taken as 0 degree, and from here clockwise they start counting up to 180 degrees. So AVF is looking into the heart right through the 90 degree, whereas AVL and AVF are looking at minus 30 and minus 150. So this becomes the triaxial system of the augmented limb leads, okay. So now you remember our bipolar limb leads triaxial system. So we just slided the limb leads from here. Limb lead was there, lead 1 was there, I slided down, and lead 2 was slided so that all the centers come at the same point. So this is how the bipolar limb leads triaxial system was made, and this is the triaxial system of the our augmented limb leads. So when I combine, let's combine these two diagrams, yeah. So now it's just showing the positive poles here. Now let's put the negative poles are made by dash lines. I'll put some dash lines for the negative aspects. of the AVR, AVL and AVF. Okay, so now the complete exacaxial diagram is made. Okay, in this, what you have to remember is two things, very important things. The polarity of the lead, of each lead. Polarity means where is the positive electrode for the each lead. For example, if I take lead 1, the positive pole is here, right? And if I take AVR, the positive pole is onto the right side, AVF here, whereas lead 2 here. So polarity, you should remember where is the positive pole of each lead, and the orientation of the lead. So always lead 1 starts at 0 degree, so orientation clockwise it is positive angles, and here anti-clockwise it is the negative angles. So I'll just show it now. So two things you have to remember in the exacaxial system: the polarity and the orientation. To see the orientation, here it goes. So lead 1 is at 0 degree, and lead 2 60 degree, and AVF at 90 degree, and lead 3 at 120 degree. Okay, so so like this, clockwise they have numbered up till 180 degree, whereas anti-clockwise the same thing is numbered in minus. Okay, so if you take this, AVR is at minus 150 degree, okay, and AVL is at minus 30 degree. So this is the orientation, and you should also remember the polarity, where is the positive. So even though it is at minus 30, AVL is at positive pole is at minus 30, and AVR positive pole is at minus 150. So this is the exacaxial system. You should remember, it's very simple. You should not at all get confused. It is a triaxial system of the bipolar leads and augmented unipolar leads combined together, and for the convenience purpose they have numbered it like that, that's all. So now you should be asking me, what is the use of this exacaxial system? Why have they numbered all this, and what is the use of this? So the use of this is to determine the electrical axis of the heart. Okay, so where the axis, whether the axis is normal or any deviation in the axis is all, you can just looking at the mean electrical axis, you can make out if there is any problem in the heart. So it's an easy way of finding out. In the upcoming classes, the future classes, we shall be discussing about the mean electrical axis and the axis deviation and all that. So that is the main use why they have used this exacaxial system. Both bipolar, unipolar together, combined together as making the exacaxial system. Okay, so that's about the unipolar limb leads. Let's move on to the chest leads now. So we had learned in the previous classes that ECG leads, there are limb leads and chest leads. So in limb leads, we extensively studied what is bipolar leads, what are unipolar limb leads, augmented limb leads which are used today. And now we are going to learn about the unipolar chest leads. All together they make the 12 leads, right? So chest leads determine the electrical activity of the heart in the horizontal plane. Can you see this? So far we saw bipolar and unipolar limb leads. They saw the heart's activity in the frontal plane, whereas the chest leads are seeing the heart's activity in the horizontal plane. Okay, electrical activity of the heart. So heart is having electrical activity. There is action potentials, depolarization, repolarization. All this electrical activity is transferred to the body fluids, either up or down or right or left, front or back. So when it is transferred front or back, that is anterior posteriorly, we can explore it by putting the chest leads. Okay, so chest leads are designed in such a way that we can put the electrodes on the chest wall and we can see the electrical activity of the heart, what's happening anterior posteriorly or in horizontally. Okay, so these chest leads, unipolar chest leads, were actually made by Wilson and his colleagues. Wilson and his colleagues made both unipolar chest leads and unipolar limb leads. Unipolar limb leads were discarded by the all the ECG society in those days, because because the complexes were very small, whereas unipolar chest leads were very well accepted, made by Wilson and his colleagues were very well accepted, and even today we use the same chest leads made by Wilson and his colleagues. Okay, so now chest leads are also unipolar leads. So unipolar means one is positive electrode, the other one is indifferent. Like, now, where is this indifferent electrode? Same thing as the Wilson terminal. They use the N-to-1 triangle. They put all the negative electrodes to all the apexes, connected each one of the apex to a resistance of 5000 ohm, and had the common terminal and connected all of them to a common terminal, making as a central terminal and making it as a indifferent electrode, where the center of it came to the center of the triangle, that is the virtual electrode was in the center of the heart. Now, positive or exploring electrode was placed on the chest wall. Okay, so in limb leads the problem was, if to the positive electrode was placed just with the negative electrode, so that's why the complexes were small. Now, to explore the heart, the chest leads were put just on the chest, okay, placed on the chest wall, which picked up the electrical activity in the horizontal plane. Now, if positive electrode is put at the chest, there won't be problem of any negative electrodes at the same place and the potentials being small. So he just put the electrodes at different places in the chest and recorded the chest activity. So this is how the unipolar chest leads were made. So the axis changes according to the chest electrodes. If you put a electrode over here, it sees the heart in this plane, and if another electrode is seen here, it is exploring the heart activity, electrical activity in this plane. So as the electrode changes, the axis also changes, but the Wilson central terminal remains the same for all the chest leads, right? So now, where to place these electrodes? So there are 6 chest unipolar chest leads. You have this manubrium and this sternum, right? So how to the fourth intercostal space can be located by placing the finger at the top of the sternum and moving it slowly. You put it at the top of the sternum. Where is my this one? Yeah, and moving it slowly downwards. After you move your finger down about 1.5 inch, you can feel a horizontal ridge. This is called as the angle of Lewis, which is located where the manubrium joins the sternum. Okay, the second intercostal space is present just below and lateral to this point. So this is the second intercostal, just below and lateral there is a second intercostal space. Move 2 more spaces down, you get the fourth intercostal space. Okay, so lead V1 is recorded here, okay, in the fourth intercostal space just to the right of the sternum, okay, and V2 is placed in the fourth intercostal space just to the left of the sternum. Then you come to the V4, okay, V4. So first you have to mark the mid clavicular line. This is the clavicle. Mark the mid clavicular line, right, straight down. So V4 is marked in the fifth intercostal space. Okay, come down, second, third, fourth, fifth. At the mid clavicular line is the V4, and V3 is present in between the V4 and V2. Okay, and where is V5? V5 is recorded in the anterior axillary line. Okay, at the same level as that of V4, in the same fifth intercostal space there is anterior axillary line, and then V6 is recorded in the fifth intercostal space at the mid axillary line. There is anterior, mid and posterior axillary line. So V5 and V6 is at the anterior axillary and mid axillary line. This is how we place the chest leads and record heart activity at different angles in the horizontal plane. So that's about the unipolar limb leads. augmented leads, and unipolar chest leads. For thorough understanding of the ECG, please go through these limb leads properly. Thank you all for patient watching.